Now focus here now, there are mounting fears of the resurgence of COVID-19 in KwaZulu-Natal after the province reported 1,818 cases over the last 24-hour reporting cycle. The situation has also been exacerbated by floods which destroyed over 85 facilities, costing the province over 200 million rands. Now let's discuss this further. We are now joined via Zoom by the KwaZulu-Natal Head of Health, Dr. Sandile Tshabalala. Dr. Tshabalala, thank you so much for your time this afternoon. Just per my introduction, KwaZulu-Natal recording 1,818 new COVID-19 cases. How ready is the province to deal with the looming fifth wave, particularly if you look at the destruction that the recent floods have made?
Good afternoon to yourself. Good afternoon to the viewers of your program. The province is worried about the resurgence of these numbers. We are worried not because only the floods have had their impact on the community of KwaZulu-Natal, but we are worried because the numbers, as they increase, the load on the healthcare workers and all the other service systems within the province will have to deal with these numbers. We're worried also because should the variant that we are experiencing now change to be a variant that needs people to be admitted or to be in ICU or to even die, that's going to have a very devastating effects. We're also worried because the fact that people have lost their houses and their places of stay, that in itself contributes to these people having to be exposed to chances higher than normal of getting COVID-19. We don't think we're at a resurgence yet, but the president and the minister will look at the country figures and they will speak to that. But the worry definitely is there. One case of COVID is too many from the experience that we've had before.
Now, of course, on top of that, the concern probably is the low number of people that have actually been vaccinated in the province. As of March of this year, we know that only 36.9% of its adult population, which is the lowest in the country, are vaccinated. So that leaves about 4.5 million people unvaccinated at the moment. That part worries us even more because in December we had hoped that we would have vaccinated 7,200,000 people, which we have not met. Up to now, we have only vaccinated 2,700,000, which is 38% of what we want to vaccinate. And we don't think that we are doing very well. We are trying all means to engage people, but to encourage them to go and vote, to go and vaccinate. The main issue are the fake news that they still believe in, and we therefore are speaking to them and say there is no scientific proof of all these fake news. But we're also asking all the other stakeholders, all the other leaders in the different fraternities, the religious leaders, the traditional leaders, the traditional health practitioners, and all the stakeholders to assist us in making sure that we partner not only with the individuals or the families, but with all these sectors such that we are able to encourage people to go and vaccinate. What is worse is that most people are not vaccinated. If you want to segregate people by color, it is the Africans who are not vaccinated in our province. Mostly when we were having high numbers of people coming to our vaccination stations, it was white people, Indians, coloreds, and the black people were not coming as much. That in itself is a worry, but we are trying to address it. Now, just recently, the MEC of Health in your province, Nomagugu Simelane, announcing the budget allocation for your department at 49 billion rands, which is reduced somewhat significantly. What are the key priorities then
as it relates to this allocation, particularly if you look at the increasing demands in the public health sector. And I mean, just from the recent floods, COVID-19, it seems like, there are more problems ahead for your department.
Look, one will not go deep into the budget speech itself as it was put by the MEC for Health in our province. She did table the 49.6 billion that is allocated to the province. But in her talk during the delivery of that budget vote, she did allude to this fact that I've alluded to of people partnering with the government. We are saying people should partner with us, firstly, by just being responsible. Secondly, when you are a consumer of alcohol, take alcohol but responsibly and do not abuse alcohol. Do not smoke, do exercise, do eat healthily, and these are the things that we expect from people. What we are worried about is not only COVID, but is the quadruple burden of disease that we're faced with. We have incorporated COVID-19 management into our system, but we then want to make sure that we are able to take care of all people who come to our facilities with all sorts of different illnesses or needs that are serviced or given by the Department of Health and the government of KwaZulu-Natal. So we're worried not only about COVID. Remember, we've just had floods. That in itself comes with its own challenges, including the possibility of diarrheal diseases. So we've had to also see how do we prepare ourselves for that. So we really are worried. As numbers of COVID-19 increase, we are worried. As other disease burden also increase, we get to be worried as well.
Dr. Tshabalala, thank you so much for your time this afternoon.